Hey guys, this is Tracy. It's Friday, May the 1st, 2009, and I wanted to give everyone an update on how my EGD test went and what they found out and what my surgeon thinks about it. So, first of all, I guess I should start with the EGD. I had to fast for the test, obviously, because they put the tube down your throat and it goes and looks at your esophagus and your stomach and the first part of your intestines, and you have to be fasting, otherwise they won't be able to see anything. So I didn't eat anything the night before. The hospital told me to be there at 10:30. So actually, I think they told me that's what time my procedure was. So we got there at 10 and started the process. And I have really bad veins, and I don't know if it's just because I'm overweight, so they have a hard time finding a vein, or if that's just how my veins are naturally. But they had to take a blood test. They had to do a pregnancy test. They had to, draw blood for that. They wouldn't take a urine test for it. So they couldn't get any veins anywhere. And they finally ended up having to do a finger prick. And they pricked my finger right here. And it was like the biggest paper cut. It wasn't like a needle. It was like a giant paper cut that I swear it felt like it went to the bone, which it probably didn't. But it kept bleeding off and on for about 3 days. And it hurt really bad, but it's fine now. Anyway, that whole process of trying to draw blood honestly, it took 30 minutes. And my husband did not know what was going on because it was supposed to be go back, draw some blood, come back out, and what had happened to me back there. So we got all that taken care of, and they wheeled me. I walked up to the endoscopic wing of the hospital where they do EGD procedures, and I was the only one there for the day, at least that particular time frame. So I got like two nurses, and they were really nice. And anyway, so I got there and I hadn't eaten. They started the IV, and I'm already nervous as it is because, well, I hate being put to sleep. And so I asked the nurse, I said, is there any way that I can not be put to sleep for this procedure, or given any medication that will knock me out or make me, kind of loopy? And she looked at me like I was crazy. And my husband goes, you don't want to be awake when they put that tube down your throat. Are you crazy? You don't want that. And I just didn't want to be put to sleep because I just have a fear of not waking up. So anyway, after she thought I completely lost my mind, I finally agreed to go ahead and have the IV and, to go ahead and just be put to sleep. Because she told me they use this medication called, let's see, I've got my report right here. It's right under my webcam thing here. Propofol, Propofol. It's really good stuff. When they give it to you, you almost immediately fall asleep. And it only lasts about, I think I was out maybe 20 minutes tops. And then I woke back up. You're still kind of drowsy, but it's not anything like you're put to sleep and you're out for like hours and you wake up and it takes forever to come out of it. Anyway, it's really good stuff. So, if anyone wanted to know that and wanted to request that if they had their procedure done, it wasn't that big of a deal, and I was able to go about my business the rest of the day. And anyway, so the doctor was about, I didn't actually have my test done until 1. The doctor was late, and when you're already nervous and you're just sitting there waiting and waiting and waiting, it was awful for me because I was just nervous. So when they put me back there in this little room where they're having the procedure done, there was like 5 different people in there. There was like 3 nurses. The doctor came in, I spoke with them, and then they make you lay on your side, and then they started giving me the medication. And I remember thinking, okay, I don't want to do this because I don't know what it is, but when they first give me medication or something, it's like I can feel my body, like I don't relax, but I feel like I'm losing control. And so I'm like, all of a sudden I went into a kind of like freak out mode. but I didn't express it. It was just kind of like internally in my head, and I was like, oh my gosh, I don't want to do this. And if this lady touches me, I'm gonna like, you know, knock her over and run out the room. But at that point, I guess the medicine really started kicking in because everything started kind of getting like whitish and gray and fuzzy. And I remember the guy, he made me open my mouth and he sprayed this stuff in my mouth to make my throat numb. And you have to spray it 3 times. They sprayed it in. And thank goodness the medicine already started working because I literally like gagged. It was disgusting. So I did that 3 times, and then they put this thing in your mouth, like a hole, like this big, and has like a bite block on it. So you bite down on it, has a hole, and they strap it to like your head. So when you fall asleep, that's where the tube goes down. So anyway, that was what happened with that, and I woke up about maybe 20 minutes later, and the doctor came in, the gastro doctor, and he told me, which I think I discussed this with y'all before about having strictures or problems swallowing, and it wasn't always. It's just like every now and then food would get stuck, and I thought it was because my indigestion had just you know eroded something. I don't know. I'm not a doctor, so basically what he found, and I see I've got my pictures here, but I'm not just gonna do like a quick glimpse. I'm sure nobody really wants to see the inside of my body. Here it is. um, he found 2 spots in my esophagus, and they looked like little rings, and it was, he called it a mild stricture, and I had 2 spots, like I don't know exactly where, but one was in the middle and one was closer to the bottom. And everything else looked normal except for my stomach, and the bottom of my stomach it was really red. So he took biopsies from both of the strictures and of my stomach because he thought maybe, it was, what's that word? I forget. It's some type of bacteria that causes ulcers. So he thought that's what it might be, and he said the rings that were causing the stricture were what he thought was some type of an allergy, like a food allergy or whatever. And he said that's what we're taking the biopsies, and he said, it's going to show if it's an allergy or not. If it is, it'll just be treated with um, steroids, and it'll reduce the inflammation and all that. So I was okay with that, and I thought, well, I guess it's better to find out if you have a food allergy now than later, so that I could go ahead and fix the problem before I have surgery. Um, he told me it would take about 3 days before he got the results back, and so I had an appointment to get my results. Well, I went ahead and emailed. By the way, he told me that I was cleared for surgery, that it was just mild strictures, and that what I would have to do is just drink a little bit of water or something before I ate, so that my esophagus was already wet, so it wouldn't catch on the way down. Um, so I called my surgeon, and I emailed him the pictures and the report because my gastro doctor released me to have the surgery, to have the sleeve. And he said from a gastro standpoint, that there was nothing that should, stop me from having the surgery because the strictures weren't anything, bad, that would hinder me from getting the surgery. Anyway, I emailed the pictures and the report to the doctor and his wife, because she's the nurse. I emailed them on Wednesday, but he was only in the office like 2 days a week, so the rest of the time he's either doing surgery or he's doing seminars, like weight loss seminars, for the different types of surgery that he does. So they didn't get the actual pictures and stuff until Monday, and his wife called me. I guess he wasn't coming in the office until 11. His wife called me at 10 and said that what pictures that they had looked at on their PDA over the weekend, and what I described was that, as it being a food allergy. She said that the doctor, the surgeon, Dr. Alanis, was not comfortable doing the surgery on